I'm Dr. Jessyka Lighthall. I'm the chief of the Division of Facial Plastic and Reconstructive Surgery. My practice encompasses all things cosmetic and reconstructive in the head and neck. I always felt called to medicine, and ever since I was a child, I've wanted to be actively treating patients with congenital deformities. So things like cleft lip and palate deformity is what really brought me into the field. I love the variety. I love being able to work with patients and restore function and quality of life and symmetry and kind of bring that improvement in patients. We treat patients who have had head and neck cancers that have been treated that need reconstruction, or skin cancers that have worked with dermatologists to remove those, and we reconstruct different areas of the face. We treat patients with facial paralysis and restore smile and function. I'd say what makes Penn State Health facial plastic and reconstructive surgery incredibly unique is that we have multiple multidisciplinary centers that are really patient-centered care. So it's almost a one-stop shop for some facial plastic needs, which is very unique in the academic world. Every day I come to work, I feel very fortunate and honored to be doing the care that I provide. Patients put a lot of trust in you to restore their function, their quality of life, and their ability just to interact with society. Every day I feel like I'm able to give back and develop those relationships with patients and their family, and I really love that aspect of what I do.